We are now into April of 2021, and I have never been more concerned for Canadians during this pandemic than I am right now. In this video, I will give you an update on the AstraZeneca vaccine in Canada. I will discuss risk, and I will also discuss variants and how we are to handle this as Canadian citizens. Thank you for joining me today. For those that do not know me, my name is Lindsay Dixon. I'm a pharmacist from British Columbia, Canada, and I have been making videos about the COVID-19 pandemic since March of 2020. So let's have a look at the evidence that we have to date. Vaccines, variants, and risk. So to put this into some perspective, because there are a lot of people that seem to think that COVID-19 still presents a very similar threat as something like influenza. So every year we have about 1 billion cases of influenza and 3 to 5 million severe cases. Out of that, on a bad year, there will be about 650 influenza-related respiratory deaths worldwide. As of March 27th, just over 1 year into the COVID-19 pandemic, there are over 125 million global cases with over 2.7 million reported deaths. And we know that these are likely very underreported because many countries are not reporting deaths or they do not have systems to accurately track this. So COVID-19 is a very serious threat to the global community. A quick update on Canada here. We are in the third wave of COVID-19 in Canada, and I am very concerned that this could be the worst wave thus far. We have a total of 30,000 cases this past week, which averages 4,420 new cases, 21 new cases daily. That is a 27% increase over last week. An average of 30 new deaths reported daily. This is a 3% increase. But when you look at this nationally, and when you look at this over a trend over time, this is very concerning, and I am worried that this will get worse. I am fairly certain it will. We have had an 8% increase in the 7-day moving average of hospitalized cases, and an 11% increase in the 7-day moving average of ICU admissions compared to 1 week ago. Reports abound of physicians who are going on social media in many different areas of Canada reporting that their ICUs are filling up rapidly. Not only are they filling up rapidly, but the types of patients they are seeing are different than the ones they have seen before. We are seeing many more patients who are much younger. We are seeing patients who did not have any comorbidities, so no other chronic illnesses or other health risks that would have put them at risk, more at risk for severe COVID-19. And this is something that we have not seen before in Canada, likely due to the new variants of concern that we have now spreading and becoming dominant in some places in Canada, including my province of British Columbia. Outbreaks have been a significant source of spread. I want to draw your attention to the places that we've seen outbreaks because we are well aware of the outbreaks that have occurred up to this point in long-term care, and these have been very severe and they've been incredibly tragic as well. But also, we are seeing outbreaks in workplaces, agricultural work settings. We are also seeing outbreaks in places like meat processing plants, hospitals, small communities, First Nations communities as well. This is something that is not unique to this time to the timing of the pandemic, but it is something that we are seeing increasingly. Many people who work in these settings do not have sick pay. They do not have the option to stay home. They need to feed their families. And some of them are going to work knowing that they are risking themselves and their family. And this is something that I think really needs to be looked at. We need to provide sick pay for these people, and we need to start rapid testing more across Canada in these settings. Hospitalization and death in Canada. I'm sorry that this chart is a little bit blurry, but if you will look at this as of March 26, 2021, the ages of the hospitalized varies, and it is across all age groups, ICU admissions as well, and we do see deaths in all age groups as well. Now, this is not including children. But this is a good chart to look at because it is showing that 1 in 10,000 patients who are between the ages of 20 and 29 who are hospitalized will die. And we know that this risk increases with age. So once you get to, say, the 40 to 49 age group, 1 in 667 people will die from COVID-19. 1 in 35 of that age group will become hospitalized. And we know that there is also a risk not of just getting COVID-19, but of long COVID, which is a disease state where the person never fully recovers, or it takes them a very long time to fully recover from all the symptoms and the inflammatory process of a COVID-19 infection. The variants of concern in Canada are spreading, and they're spreading rapidly. To date, the P1 variant is spreading quite quickly across Western Canada. It has also been detected in other parts of Canada. The UK variant, or the B117 variant, is also becoming dominant in many parts of Canada. And the South African variant has also been detected in many provinces. 50% of cases now in British Columbia are due to variants of concern. This is primarily the B117 variant and the P1 variant. We know that these variants of concern are much more transmissible. They can lead to more severe disease, and many times we are seeing that they are affecting the younger population more severely. Dr. Mark Romney at St. Paul's Hospital recently said that the variants his lab was detecting had shifted, with the P1 variant more common than B117. The P1 variant is the variant that is becoming dominant in Brazil right now. And Brazil is in a humanitarian crisis right now where their hospitals are overwhelmed. Of course, Brazil is a very complex society and there are many socioeconomic factors at play. But do not allow that to cloud your image of how serious the spread of the P1 variant is in British Columbia and in the rest of Canada. Dr. Mark Romney has also said that P1 is considered by some to be the most concerning of all 3 major variants of concern because of what's happening in Brazil, but specifically because it's considered to be more transmissible. It is probably more virulent, and it is probably more prone to immune evasion. And it is up to 2.2 times more transmissible than the original virus. In British Columbia, we have a minimum of 480 confirmed cases of P1. This is more than any country outside of Brazil has recorded. The P1 variant has been found in about 41 different countries right now. But British Columbia, and specifically the Lower Mainland, Vancouver area, Fraser Health area, seems to be the epicenter of this outbreak. And I'm very concerned about this. Recently, a couple of days ago, Alberta reported a significant outbreak of P1 linked to a returning traveler. They still do not know how many cases this has led to, and they are still investigating, and they are trying to contain the spread. But it is very difficult, especially when you get to this point. All right, let's transition to vaccines in Canada. So in Canada, we have 3 vaccines that have been approved by Health Canada. We actually have 4, but 3 that are available right now. We have Pfizer, we have Moderna, and we have the Oxford AstraZeneca vaccine. The Johnson & Johnson vaccine has also been approved, but will not likely make it into Canada until maybe September, maybe a little bit later, as there are some signs that they may be having some difficulty with production at this moment. I want to draw your attention to vaccine safety reports. These reports are online and are accessible to the public. All vaccines in Canada and all medications are monitored constantly for safety. And I will give you the link to look at these safety reports in more detail. Many of my viewers have asked me to look at this, so that is why I'm taking a moment to look at the current safety reports on the vaccinations in Canada, the COVID-19 vaccinations in Canada that have happened thus far, and what reports are available. To date, we have 4.8 million doses of all of the vaccines total that have been administered. Out of that, 2,859 adverse events, which is a 0.060% of all doses administered. So an adverse event gets documented whenever a patient reports something that is outside of the normal pattern of side effects, or if it's something that a medical professional, like a physician or a pharmacist or another healthcare professional, like maybe a nurse, if they think that it is worth documenting and sending in to be reported. So out of these reports, 2,475 were considered non-serious, 384 were considered serious, which is a 0.008% of all doses administered. The majority of these are anaphylaxis, which is an allergic reaction that occurs rarely, but it does occur, and it is very treatable, and it is easy to diagnose very early. And so it's not something that one should be concerned about, but it is something that we report. And the number of reported adverse events was highest among females and those ages 18 to 49. The number of adverse events in Canada reported by vaccine name up to and including March 26th, which is the last available date that I have for this data, can be seen here. Now, of course, because we have given more of the Pfizer vaccine and we have given more of the Moderna vaccine, we will see more of these adverse events. And the Covishield vaccine, which is the Oxford AstraZeneca vaccine that is being produced out of India, is showing fewer reports because we have given less of it. However, I still do not see any great concern here. I'm just showing you that this is being monitored, and these are the numbers for those who are interested. These are the most frequently reported adverse events, and to the side of that, you can see the number of adverse events as well. And so vaccination site pain being the most common. After that, we have site swelling, site warmth. These are very common reactions, but they were enough for someone to report. And at the bottom, I wanted to draw your attention to the adenopathy or lymphadenopathy or adenopathy, swollen lymph nodes. And this is something that we've seen with these vaccines. We're quite aware of it. And so often under the arm area will become quite swollen. A lymph node will become quite, it's almost like it's irritated, but it's not. It's actually just responding to the vaccine itself, and this will be reported. So that is something that is somewhat a little bit unique to the COVID-19 vaccines, or maybe we're just seeing it a little bit more so than with other vaccines. But it is a sign that the immune system is recognizing this, and it is working, and it will produce the appropriate antibodies to produce immunity. So for those who are interested, you can just put your phone right up to this code, and this is the QR code that will take you to the website, the Health Canada website, where you can look at these side effects and adverse effects reports, and many of the ones that I've just shown you, but it does go into a little bit more detail for those who are interested. So feel free to have a look at that. Okay, so the AstraZeneca vaccine and VIPIT. What is VIPIT? So recently I did a video about the AstraZeneca vaccine in Canada and how Canada has paused the AstraZeneca vaccine for anyone under the age of 55 until it receives further clarification on the incidence of a clotting syndrome that seems to be emerging in different parts of the globe. To date, Canada has not had any reports of this happening with any of our vaccines, specifically the Oxford AstraZeneca vaccine. So I will put a link up here to the video that I just made about the Oxford AstraZeneca vaccine, but I'm going to give you an update right here. So VIPIT is now, we have a name for this, vaccine-induced prothrombotic immune thrombocytopenia. There's a little bit of controversy over this because the German scientist who named this is he is concluding that this is caused by the vaccine, but some people want to see more evidence. Some scientists want to see more evidence before we say that it is vaccine induced. But at this point, it is known as VIPIT. And according to NACI, this is associated with the development of antibodies that activates platelets, and this stimulates the formation of blood clots, but it's also associated with low platelet count thrombocytopenia. So it's a little bit confusing to understand exactly how this is happening. Essentially, it's an autoimmune response that we're seeing, we think, but this is evolving quite quickly. And so we will have to pay attention to the new information that emerges even in the next days and weeks here as to how they are understanding this process. The Health Canada statement on the AstraZeneca vaccine currently is saying that they do not want this vaccine to be used in people under the age of 55 because of the reports that have happened globally. Health Canada wants to investigate this further and see what is going on and understand it better before they give it to people under this age, because it is affecting people ages 25 to 55, and especially women more severely and with more incidence than it is anyone else. So in Australia, 420 vaccinations of the Oxford AstraZeneca vaccine and 1 report of blood clots. This was in a male, 44 years old. This is a very recent report. And the chief medical officer in Australia said, "We continue to be at risk of another serious outbreak of COVID-19 in Australia at a time where the population has no immunity from either past infection or from vaccination." You will note that Australia has been very good in containing the COVID-19 pandemic. One of the few downsides of this is that they do not have any immunity to the virus. However, as we're seeing with the emergence of variants, that might not be a consideration for any of the countries that have just let this virus spread, because the variants don't seem to care about previous infection. If we experienced a severe outbreak, the risk is far greater than the small potential risk of a very rare clotting disorder associated with the vaccine. And I'm stating this here, I'm leaving this here because I want you to start thinking about the situation we find ourselves in Canada and different places in the world, where COVID-19 is a real risk to all of us. And it's up to us to make an assessment of that risk and think about that in how it regards to vaccines. So more of these reports. The United Kingdom reported 30 cases in 18.1 million doses. And I think they've reported 8 deaths, maybe 15 deaths. It's 15 deaths. But they are being investigated as to whether they are directly related. In Norway, 5 cases. Most of the vaccines in Norway went to women, so 5 cases in 130,000 doses, so that's a higher incidence in Norway. The United Kingdom was vaccinating people who are much older, and so that may account for the reason that they have seen a lower incidence. The Netherlands was also vaccinating more of their women. They've seen 5 cases in 400,000 vaccinations. Germany is reporting 1 in 100,000. Canada has had no cases thus far, though we have not given much of the vaccine. The COVID-19 science table of Canada say that based on all of the evidence that they have seen, the data that they have seen, the risk or the incidence rate is about 1 in 125,000 and 1 in 1 million. These are some of the symptoms to watch for. Usually this VIPIT is what they're calling it, so we'll call it that. VIPIT occurs between 4 and 20 days post-vaccination, and these would be the symptoms that you would watch out for. So they're very similar to the symptoms you would see with a blood clot or a stroke, and I did go over all of that in my previous video as well, but I thought I'd put them here for you to maybe take a screenshot, and then you can monitor for symptoms if you know someone or if you yourself has had the AstraZeneca vaccine. Again, this is very, very, very rare, and it is very treatable if you catch it early enough. So let's talk about risk, because we have all been trying to protect ourselves from COVID-19 over the past year, and we have been quite averse to the risk, most of us, of getting COVID-19. But now we see risk with a vaccine, and I want to try to put that risk into perspective for you. And in no way am I trying to minimize the seriousness of this adverse effect that may be linked to the vaccine. But the fact is that in Canada and in many places of the world, COVID-19 is widespread in all communities, and the variants are catching up quickly and becoming dominant. So we are all at risk, no matter what our age, no matter what kind of health issues we have, no matter whether we are in perfect health. We are all at risk because we do not have immunity against this virus. And so we all need to think about what risk we are going to undertake, and also how that risk affects the people that we love and affects our communities. And it's a very difficult conversation, but I wanted to outline a few things for you here. So like I said, we need to look at the risk of being exposed to COVID-19, the original virus, and now the more transmissible and often more severe, possibly more lethal variants. The risk of developing a blood clot from infection with COVID-19, which is said to be between 1 in 20 if you're hospitalized and 1 in 50 if you're not hospitalized. The risk of a severe infection, which has left many people with reduced lung capacity, complications from ICU admission, and there are many other issues that people are dealing with now because they've had a severe case of COVID-19, and also the risk of something we call long COVID, which is a prolonged syndrome where the person is suffering from the symptoms of the inflammatory process and everything their body went through. And there are theories that there actually may be a viral remnant that remains in the body and that the body has a very long time clearing. And this causes people, it's very similar to something like chronic fatigue, otherwise known as myalgic encephalitis, where people cannot work, they cannot think properly, they can barely make it up the stairs. It has a dramatic impact on their quality of life. And some of these people will get better. Some of these people, we don't know. Some of these people have been suffering from this for over a year now, and this is still ongoing. So this is a risk that we take as well if we're not vaccinated. In influenza in Canada, we see about 1 death in 300,000 cases of influenza. Yet I don't think many people really worry too much about influenza. It is true that it does seem to affect older people and also young children more severely. But with this incidence, not many people walk around concerned during the flu season that influenza could cause their death or death of a loved one. In 2019, there were 18 deaths from influenza and pneumonia in Canada per 100,000 population. If we go back to the current incidence of a severe clot or VIPIT with AstraZeneca, and according to the Canadian Science Table, that's about 1 in 125,000 or 1 in 100,000 to 1 in 1 million. And so 18 deaths from influenza and pneumonia per 100,000 people is much, much higher than that. Cesarean section, 1 in about 5,800 people will die from a cesarean section, yet women go through cesarean sections every day, every hour. Tonsillectomy, which most people wouldn't think twice about getting if it was recommended by their physician, it's about 1 in 10,000 to 1 in 35,000. So that's about 1.5% to 14% mortality rate. But tonsillectomy is still thought to be very, very safe. And it is, but there is always, always risk. Between January 21st, 2020 and March 28th, 2021, there were 30 million cases of COVID-19 in the United States, and the virus had claimed 546,000 lives. In that 1 year, this is approaching the estimated 675,000 Americans who died in the 1918 flu pandemic. And this is still ongoing. Though we know that now with vaccination, we expect to see the numbers declining in the United States, and there are some indicators that that actually is now happening. So I want to thank you for joining me for this. I think that what it comes down to is that COVID-19 is a real risk for all of us. COVID-19 is not going away. The more this virus spreads, the more we have the chance of more variants. And this represents risk to all of us. And it represents risk to our communities and to those who are most vulnerable in our communities. People who are already sick, are already immunocompromised, and are already taking medications or suffering from illnesses that cause them to be more vulnerable. And so our decision to get vaccinated has an effect on the rest of our community. And when we look at the balance of risk, we all take so many risks every day. Even getting in your car is a risk. And many people die every day when they decide to go out in their car. And in no way am I trying to trivialize this risk, but we are in a very, very complicated situation here in Canada and in many places in the world where COVID-19 is a real risk. And if you do get COVID-19, there is no guarantee that you will have mild illness. And if you do get the vaccination, these vaccines are highly, highly effective. The side effects are very minimal. And the side effect that we're seeing from AstraZeneca is very, very rare. But it is a risk. And it's something that we need to come to terms with. And I'm trying to help you make an educated decision here so you can provide informed consent when you go to see your healthcare provider, your pharmacist, your nurse or physician to receive the COVID-19 vaccine. I realize that this isn't a spot that any of us would want to be in. We would never choose to be in this position, but we are, and we all have to make this decision. And so I hope this information has helped you. I will continue to provide this kind of information for you. And please let me know if there are any questions, any other resources, or anything else that I can do to help you make this decision for you and your family. Thank you so much for joining me. I appreciate your time. Take care and stay healthy. Bye-bye.